I'm Dr. Tanya Gesek. I am a visiting assistant professor at Syracuse University. I also have a part-time private practice working with children and families, and I'm a school psychologist.
Okay. How did you become interested in psychology?
I first became interested in education, actually. I really knew I wanted to work with children, so I started off in college as an education major, but then quickly realized that working with multiple children maybe wasn't my thing, and so I switched and shifted to psychology, and I focused on child and adolescent classes.
Okay. Now, psychologist, the term psychologist means a lot of different things for a lot of people. How would you define a psychologist?
I would define a psychologist as a person with the top-level training to understand, in very general terms, human behavior. Why people do the things they do, how we can help people do things a little bit better and make better choices. But, you know, the top-level experts in human behavior.
Okay. And how would that differ from what the general public views psychologists as?
I know that there's a lot of confusion in the public domain, public knowledge about the difference between psychology and psychiatry. But I would say that we are the professionals to work with mental health issues, with behavior issues. We are not trained as medical doctors, but we have the best and most extensive training in mental health and behavior.
Okay. Now you brought up a very interesting topic of mental health professionals. Mm-hmm. There is a push for other professional licensures and degrees. Other clinicians serve as mental health providers. How do psychologists differ from, let's say, a social worker or a mental health counselor?
Mm-hmm. Well, many psychologists are trained at the doctoral level, either with a PhD or a PsyD. And I think what sets us apart from many other mental health professionals is that we have extensive training in understanding and putting together research. So we have a much better understanding of what the research is and how to use it in the most effective way. We have a more extensive training in the terms of length of our training and supervision. So we've had more opportunities for supervised practice. Beyond other master's level mental health counselors. And psychologists often also have extensive training in assessment and diagnosis and evaluation, which many other mental health practitioners don't have.
Okay, I understand. Now you said you're a school psychologist. What does a school psychologist do?
Well, a school psychologist can do a variety of things depending on the level of training. We certainly do work in school environments. There are two different paths towards school psychology. One is a master's track and one is a PhD track. Both lead to the opportunity to work within a school setting. So specifically taking the principles of psychology and applying them to helping students overcome barriers to learning, overcome barriers to being successful in a school environment. The PhD training in school psychology adds an added benefit of training, an added amount of training, which offers more flexibility. At least here in New York State, school psychologists are eligible for a license and can practice outside of a school setting as well. But we're specifically trained to work with kids and families, and if you know you want to work with children, school psychology degree is a great way to go.
Now, how does a school psychologist collaborate with principals and other professionals in order to best serve their clients?
Mm-hmm. I think that's at the core of what most psychologists are trained well to do, especially at the doctoral level. School psychology training programs include extensive training and consultation, the ability to be able to work with a variety of not just the kids in the building, but the adults that are also staffing and serving the children. I think school psychologists are perfectly poised to work as team members. They're good at facilitating team process and making sure that that all the professionals in a school building work together to best serve the needs of the child.
Now, what is the clientele, or what is a typical diagnosis that someone who comes to a school psychologist would be faced with?
Well, typically school psychologists that work specifically in a school setting don't have diagnosis as part of their part of their job responsibility. But as I mentioned, a school psychology PhD can lead to a license in most states. And it's in those private settings that school psychologists can help with evaluation and diagnosis of things like ADHD, learning disabilities that may not have been caught in the school evaluation, and other social and emotional factors that might be getting in the way for students in schools.
Can you talk to us a little bit about what an ADHD assessment would look like?
Mm-hmm. Quite often things like ADHD are first screened in a schools. And even a master's level school psychologist is a key figure in helping to identify those early red flags. But then an outside psychologist, clinical or school psychologist license, takes it that next step to kind of fully flesh out the symptoms related to ADHD, ruling out other possibilities, and possibly doing more kind of cognitive and academic evaluations to rule out, other things that might be, that might present as ADHD.
And what about emotional disturbances and things like that?
Mm-hmm. Quite often it's the PhD level school psychologist that is asked to make those kinds of evaluations. When there's a question of depression or anxiety or other more serious mental health issue, emotional issue, typically it is the PhD level child clinical or school psychologist that's asked to make those kinds of diagnoses.
And what are some of the unique challenges that a school psychologist may face in professional practice?
I think often there's just some confusion about the difference. For me at a doctoral level, working as a licensed professional in the community, quite often people want to know the difference between what clinical psychology is and school psychology. There's a lot of overlap between the two. So the challenge becomes educating the public about what some of those differences are. And what I have as an added benefit, I think, over a child clinical psychologist is a full understanding of the education system and how that works, and the school environment that the child is a part of, and understanding the academic component to a child.
And what if a parent and a child are at odds? How do you deal with a conflict? The parent views their child one way, but you see the child a different way.
I think that's one of those things that probably comes up in a lot of independent practitioners, daily practice. Quite often, it's very common for kids to see things one way and parents to see things another way, and it's just about trying to find some common ground. There's always a way to find, some commonalities between what people are concerned about.
Can you talk a little bit about how you stay current within the field of school psychology?
Mm-hmm. I think teaching at a university kind of helps that. As I'm preparing lectures, I'm trying to stay on top of the most relevant information, and having colleagues around me that are doing research in school psychology certainly helps me to stay very current. But I attend workshops, and I speak with colleagues in the community, go to peer consultation groups. But being at the university is very helpful in that regard.
And lastly, I'd like to conclude with a little bit about yourself and what you're most proud of in your professional career.
I think having the PhD has just been able to give me such flexibility, and I'm proud that I can say that within a week I teach a class, I work with kids, I work with parents, I balance my personal life, and I can give back to my profession as well, through my work with the New York State Psychological Association. And I just think that being able to do a variety of things makes me very proud.